I'm the Global Director for Healthcare Life Sciences in Google Cloud. And in this role, I lead the strategy and also have the front row seat working with the researchers, AI scientists across the company to help transform, take the cutting-edge research and bring it into reality through Google Cloud. Just to ground, Google Health is a company-wide effort to help billions of users live healthier lives. And when I say billions of users, just to give you a data point, 1 in 20 searches on Google are healthcare related. 75% people, before they go to ER, they go to Dr. Google. And when you are coming to us for material health information, we need to get it right. Whether you're reading about a disease, about diabetes, or finding out how my medical device works on YouTube, or finding your wayfinding for maps to get to the hospital, there's AI at work. So for the message for AI skeptics, we already are using AI in all of our products, especially in healthcare as well. Google's rich history also informs our work in healthcare. For past several years, we have been building in the intersection of AI and in healthcare. A couple of examples. We have built AI systems that detect breast cancer with the accuracy of a radiologist today. We have deployed deep learning for diabetic retinopathy and are also scaling it through our partners, IDX. And in India, it's also being deployed for hundreds of thousands of patients where there's a lack of eye doctors. So this is deep learning, already started in 2016. And the pace astounds me on generative AI. Just last year, we introduced our medically tuned foundation model called MedLM. It was the first state-of-the-art model to pass the US medical licensing exam with a passing score. In the current iteration, the model is passing the exam with 91%. The passing score for the exam is 60%. So, and it's also not just passed the US exam, it also passed the Indian medical licensing exam. So then the question becomes, okay, we have a powerful technology. It understands the nuances of the medical and scientific knowledge. But we want to ground it on real-world use cases. So I'll give you 3 examples where MedLM is being deployed in the field. Peter talked about scale. The number 1, and it's been talked about, Zayed, in your talk, it's called pajama time. If you're not familiar with this term, in healthcare, your physicians will very fondly tell you that for every hour they spent on patient care, they spent 2 hours going home, working with the EHR, reading and writing documents. Now, we can all hate documents, but they are a very critical part of clinical workflows. That's where the care decisions are documented. So, zooming out from the industry perspective, there is 10 million shortage of healthcare workers by 2030, so WHO statistics. And yet, when you look into the nursing, in US, nurses spend 41% of their time on documentation. So we wanted to test this theory. We worked with HCA. They have 188 hospitals in the country, 100,000 nurses, and say, what could be the use case where this powerful technology can be used? And what we heard from nurses and clinicians, we found a use case called nurses shift summary. It is when you're in the hospital and the nurses are having 7 to 8 patients. Before the new nurse comes, they want a summary. Today, it's either handwritten or manual. There are 40,000 of those handoffs in a given day. It takes 75 minutes for that handoff. So let's say, if you only say 5 minutes, conservative number, the model in the third iteration is already much better. 5 minutes into 40,000 is 200,000 minutes on a daily basis going back to the care delivery. So a minute you save is minutes going into the, under the care team. The second example is healthcare is inherently multimodal. Your doctor is just not looking at you, they're looking into how you're talking, your images, your x-ray, it's all of that data combined. And technology is advancing so fast. Our Gemini, our latest model, 1.5, it's multimodal from ground up. What that means is it was trained natively with audios, videos, images, texts. And just to give you a glimpse on the capability, it's not a healthcare example, because of its multimodality training, it has a very sophisticated understanding and reasoning. It was given a 45-minute silent movie. There was no voice there. And the model was able to ascertain the plots, the characters, and very nuanced understanding of what happened in the movie. So these models are getting faster, much more sophisticated with the reasoning. Now, when we have MedLM multimodal, we are deploying that with chest X-ray in India. We're working with partner Apollo Hospital, and they are going to leverage this for screening of heart and lung conditions. And TB is a big burden in India. 2 million tuberculosis cases, not enough doctors. So we are finding a sweet spot is where there is tremendous amount of data. We talked about medical imaging. 90% of healthcare data is actually imaging. 90%. So now we are now looking into, can we take this and deploy where there's lack of access? In healthcare, we all talk about access all day long, but that's where these kind of technologies could be a game changer for screening. A third is prevention. In healthcare, we often talk about inpatient is a failure of outpatient, outpatient is a failure of home health, and yet our healthcare is not just the 2 times you visit the doctors. When you're wearing a wearable today, there's tons of data, so just today we announced our research into a personal health large model. What it does is it takes your time series data, so if you are, let's say, a 40+ female, here's my 4 months of sleep data, my pattern, take my time series. It creates a pattern program, does the number crunching, finds out the trends. But here's the kicker. It then combines the medical and scientific knowledge and gives a very personalized recommendation. So your personal coach. Very, very few people in the world, 0.1%, have the kind of concierge health and the personal coaches. We believe AI can be that coach for all of us. This is where the democratization of healthcare has to occur. And I know my time is up, but these are the kind of glimpse into how we view AI to be transforming health at the planetary scale. Thank you.